Hydroxychloroquine. Okay, I bet you've heard that name before, right? A few years back, it was everywhere, in the headlines, all over social media. But what if I told you that all that noise was just one tiny piece of a much longer, way more fascinating story?
So let me ask you, you've definitely heard the name, but do you know its real story? Do you know where it even came from, or how it actually works inside the body? Or who it helps, day in and day out, far away from any cameras or controversy? Well, let's get into it.
You see, what we're about to unpack is basically a tale of a drug with a split personality. It has two completely different identities. On one hand, for some people, it's an absolute lifeline. On the other, it's become a symbol of intense debate. So how can one little pill be both of those things? That's the puzzle we're here to solve.
All right, so let's jump right into the heart of it. This drug's two identities. We're going to look at that huge gap between its role as a lifeline and its time as a source of controversy. And this really lays it out perfectly. For decades, hydroxychloroquine has been a quiet hero, a cornerstone treatment for patients with autoimmune diseases like lupus. Just a steady, reliable workhorse. Then, boom, almost overnight, it's thrown into the global spotlight and becomes this huge, controversial figure, debated as a treatment for COVID-19. It's a wild story, and to really get it, we've got to rewind and go back to the beginning.
So, let's trace its journey, which, believe me, is truly unexpected. This story doesn't start in some sterile modern lab. Nope, our story starts deep in a jungle centuries ago.
Okay, so check out this timeline. It all starts way back with quinine, a substance from the bark of the cinchona tree used to fight malaria. Fast forward to the mid-20th century, scientists whip up a synthetic, less toxic version. First chloroquine, and then our guy, hydroxychloroquine. But here's the twist. After World War II, doctors started noticing something really weird. Their patients being treated for malaria who also had arthritis or lupus, well, their joint pain was getting better. It was a complete accident. That serendipitous discovery changed everything and set it on the path to becoming the go-to autoimmune treatment it is today.
And that happy accident landed it in a very special class of drugs. See, it's not just a painkiller, it's a DMARD. That's a disease-modifying antirheumatic drug. And the name says it all. The key word is modifying. Its goal isn't just to make you feel better. It's designed to actually get in there and slow down the disease itself. That's a huge deal.
Which, of course, brings us to the big question, how does it actually do that? Well, this is where the split personality story comes back, because it works in two totally different ways depending on what it's fighting.
I mean, just look at this. It's incredible. When it's fighting an autoimmune disease, it's an immunomodulator, a fancy word that just means it tells an overactive immune system to, take a chill pill. But for malaria, whoa, a completely different playbook. It gets inside your red blood cells and literally starves the malaria parasite by cutting off its food supply. Same drug, two wildly different strategies. So let's look a little closer at how it calms the immune system. Imagine your immune system has these little alarm bells. The technical term is toll-like receptors. When they start ringing, they trigger inflammation. What hydroxychloroquine does is it basically comes in and puts a little damper on those alarms. It stops them from ringing so loudly, which quiets down that whole mistaken immune attack.
And all of that brings us to the chapter everybody remembers, the COVID-19 firestorm. This whole episode is a fascinating case study of how science works, how it moves from a tiny glimmer of hope to a solid scientific conclusion, all while the entire world is watching.
You can really break the whole thing down into 4 steps. First, there was the spark. A few studies in a lab, and I mean literally in a test tube, not in people, suggested it might block the virus. Well, that tiny spark ignited a global frenzy of hype. But that led to the most important step, the test. Scientists launched huge, rigorous, gold standard clinical trials to see if it really worked. And finally, the verdict. The results were clear. It did not treat or prevent COVID-19, and the potential risks just weren't worth it for a benefit that wasn't there.
And this, right here, is really the key lesson from that whole saga. It was a massive, global reminder of why we have to wait for strong scientific evidence from big trials, instead of just running with early lab results or personal stories. So let's bring it back to the folks who actually rely on this drug every single day for its approved uses. What's the reality for them? Well, it's all about careful safety and monitoring.
For anyone on this long term, there's one number that's absolutely crucial: 5 years. After about 5 years of taking it, the risk of its most serious potential side effect,
irreversible eye damage starts to increase. And that is exactly why mandatory annual eye screenings are so important.
This table gives you a really balanced look. On the left, you've got the more common, less serious side effects, things like nausea or headaches, but on the right are the rare but serious risks that doctors are always watching out for, like that eye issue we just mentioned and even potential heart rhythm problems. It's a powerful drug, and it demands respect.
And that's why this monitoring system is absolutely non-negotiable. It starts with a full eye exam before you even take the first pill. It continues with those annual checkups, and it totally depends on a partnership between the patient and their doctor, keeping those lines of communication open. This careful process is what makes it a safe and effective treatment for the long haul.
So in the end, we're left right back where we started, with this drug's two identities. On one side, it is, without a doubt, a vital, life-changing medicine when it's used correctly. And at the same time, its recent history serves as a really powerful cautionary tale about what happens when hype gets way ahead of the evidence.
The COVID chapter of this drug's long story might be over, but it leaves us with a pretty critical question, doesn't it? The next time there is a global health crisis, and there will be a next time, with all the pressure and all the fear, how are we all going to do a better job of separating genuine hope from all the dangerous hype? That's something really worth thinking about.